Hello, good morning, everyone. This is Dr. Lama Ghandoura, Family Medicine Resident, Postgraduate Year 3 from King Abdulaziz Medical City, Ministry of National Guard Hospital, Health Affairs. It's my pleasure to give you an oral presentation about my research, which is titled Liraglutide Effects on Glycemic Control and Weight in Patients with Type 2 Diabetes Mellitus, a real-world observational study and brief narrative review. The outline of this presentation will start by background, objective, then methods. Then we'll discuss results, limitation, and conclusion. Type 2 diabetes mellitus is a major public health problem due to its association with significant morbidity and premature mortality. As we all know, globally, more than 300 million people have type 2 diabetes, and this number is predicted to rise to more than 500 million by 2030. Saudi Arabia is in the top 10 countries with the highest diabetes rates among adults, the prevalence rising from 7% to 32% from 1989 to 2009. The management of type 2 diabetes aims to prevent the development of disease by improving glycemic control, which is measured by the glycated hemoglobin. Glycemic control and weight gain are two essential considerations in the pharmacological management of type 2 diabetes. Unfortunately, pharmacological agents are effective in lowering blood glucose level, but may result in significant weight gain. Liraglutide effectively maintains glycemic control while reducing weight by increasing insulin secretion, decrease glucagon secretion, delaying gastric emptying, and decrease appetite. The objective of this study was to evaluate the effectiveness of liraglutide for the treatment of type 2 diabetes in routine clinical practice. The study was approved by an institutional review board of the King Abdullah International Medical Research Center, and this was non-experimental retrospective observational study used best care electronic health record. Data were collected between November 2019 and March 2020, and this was multi-center study conducted at 3 hospitals under the Ministry of National Guard Health Affairs, King Abdulaziz Hospital in Al Ahsa City, Imam Abdulrahman bin Faisal Hospital in Dammam City, and King Khalid National Guard Hospital in Jeddah City. The Ministry of National Guard Health Affairs is a large integrated healthcare system established in 1983. It provides state-of-the-art medical care to the National Guard soldiers and their dependents in all regions across the Kingdom of Saudi Arabia. The study included type 2 diabetes mellitus patient aged 18 years and old who initiated liraglutide between January 2017 and December 2018 and received treatment for a minimum of 3 months and up to a maximum of 36 months. All patients were required to have A1C and weight measured as a baseline, and A1C and weight measure at a follow-up at either 3 to 6 months, 7 to 12 months, or 13 to 24 months after initiation. In the beginning, the eligible patient was were 640. Then we excluded patients who received less than 3 months of liraglutide. There were no baseline weight or follow-up weight, and also there were no baseline A1C and follow-up A1C measures. So the included patient at the end were 348. The covariates were the presence of the comorbidities, hypertension, dyslipidemia, kidney disease, and ischemic heart disease, and the number and type of hypoglycemic agent. This table is showing the baseline demographic and clinical characteristic. The majority of patients were female and below the age of 60 years. The majority were also using insulin by 77%. Metformin was most frequently used oral hypoglycemic agent in 279 of subjects, and the majority had a comorbidity, with dyslipidemia being the most common by 70%. Okay, the baseline mean A1C was 9.1, and this table shows the change in A1C with time. There were statistically significant difference in A1C levels compared to baseline at 3 to 6 months, 7 to 12 months, and 13 to 24 months, with the p-value less than of 0.05. There were no statistical significant changes was seen for A1C with any covariates as shown here in this table. And this figure, the red line represent the subject with 9% of A1C and greater than 9%, and the blue line represent the subject with less than 9%. And the figures show there is a change in A1C between those subjects with the p-value less than 0.05. Regarding change in weight, the baseline mean weight was 101, and this table shows the changes in weight with time. There were also statistically significant difference in weight from baseline at 3 to 6 months, 7 to 12 months, and 13 to 24 months, with the p-value less than 0.05. This table also shows no statistical significant changes for weight with any covariates. And here the figure, the red line represent subject whose weight were more than 100 kg, and the blue line represent the subject whose weight were less than 100 kg. And there were a statistically significant between both with the p-value less than 0.05. Adverse effects were noted in 58 of subjects who discontinued liraglutide. 9 cases due to adverse effects, 7 of them due to gastrointestinal side effect, 1 of them due to endocrine side effect, and also 1 of these 9 cases discontinued liraglutide due to central nervous system side effect. And 49 of cases discontinued liraglutide due to unspecified cause. There are a few limitations to be highlighted in this study. It is inconsistent. There were inconsistencies in data collection with missing data elements. As I said, the data collected used the best care electronic health records or prescription order indicate the drug is prescribed, but it does not mean the patient took the medication. No assessment of adherence, the duration of diabetes was not readily available, and also the changes in diabetes therapy, such as addition of medication or a change in insulin dose, may affect or contribute to the changes in A1C in this study, and subjects may not be representative for the population. So, in conclusion, liraglutide used either alone or in combination with other hypoglycemic agent was effective at reducing A1C and weight in patients with type 2 diabetes in this real world setting, and the finding confirmed those seen in RCTs. This study is helpful in evaluating the effects of liraglutide in this region of the world. These are my reference. If anyone had any question, more than welcome, and thank you.